Is that a halo around you, Craig, or is that something on the wall?
I'd love to say it was a halo, but anyone who knows me knows there's not a hope of that.
These are all just degrees I just put up for meeting purposes.
Well, I'm impressed. Yeah, no, that's my mirror.
The Hamilton Spectator covered a story on the background of every virtual council meeting, what their councilors had in their home offices, and it would covered, artwork and their degrees and whatever else was showing. And I think one was in a part office, part laundry room, and they covered what type of appliance brands she was using.
Well, I've learned more about my staff by looking at their houses through Zoom than I ever knew by working with them.
I can just see if this continues, Bernie will have a sign at election time being say vote Bernie.
No, Bernie's had enough. Let the younger generation come up, like Rob's friends. Get them all in there.
All right, welcome everyone. I'm just trying to get everybody pinned here on this big screen because there's so many of us. Does everyone, Councillor Taylor, do you have your video on? Councillor Huffman, same. I don't know why I can't see you.
Yeah, mine's on. Not coming up. I'll toggle it here.
So they tried to prep me for this because they said to go to large gallery in order to 8 people, but I can't get that. Sorry, guys. Okay, so Norfolk County councilors, just so I'm aware who's here. So we have quorum. We have Councillor Taylor, Councillor Martin, Councillor Columbus, Councillor Van Passen, Councillor Huffman, and myself. I believe Councillor Michelle is arriving late. Councillor Rabbit sends his regrets, and Councillor Columbus, I know you're going to have to step away, right? So that will require everybody else is going to have to stay with the meeting for the duration in order to maintain quorum once Councillor Columbus steps away. So with that, I'd like to call to order the Haldeman Norfolk Health Unit Special Board of Health agenda. Welcome to all of our Haldeman County councilors and Mayor Hewitt, and Ms. McKenna, welcome to you as well. Thanks for joining us today. We'll try to get through some of the formalities, a few items pretty quick on the agenda, and then get right into your presentation. No ceremonial or activities today, rather, but if I could have a seconder of the agenda. Councillor Columbus, seconded by Councillor Taylor. All those in favor? And that's carried. Next, any declarations of pecuniary interest from county? Okay, seeing none. Moving on to the items of communication. First, we have a communication from Kathy Case, General Manager of Corporate and Social Services from Haldeman County. That was deferred from the February 2nd, 2021 Board of Health meeting regarding the COVID-19 compensation matters. We're going to receive that as information unless there's any discussion on that matter. If I could have a mover and a seconder. Councillor Taylor, seconded by just I think Norfolk County councilors can second these items just because you guys won't have any voting privileges. Councillor Huffman, thank you. All those in favor? And that's carried. Next item, Norfolk County Council, February 16th, 2021, Resolution 29. Again, staff recommendation to receive this information unless there's any further discussion. Okay, and I see a hand up just with the letter R. I'm not sure who that is. Oh, Rob, is that you? No, your hand's not up. Councillor Shurton, sorry, my apologies.
I believe mine was up and I thought it was down, so.
Okay, perfect. Thank you, sir. Sorry. All right, so mover
Mayor
and seconder for item 4B.
Board of Health Chair Chaw.
Yes.
Just that in addition to motion number 3 there with resolution 29, there's also a tack on that the board waives the procedural bylaw to enable the Ontario Nurses Association to provide a presentation.
Okay, I don't have that in front of me, unfortunately, Kevin, so unless I missed it here.
So just for clarification.
Oh, I see here. Yep, page
Okay.
6. Thanks.
Just so everyone knows what they're voting on there.
Okay, so we'll receive that as information. All those in favor? And that's carried. The next motion, I see it's been moved by Councillor Taylor and seconded by Councillor Van Passen that Council directs staff to place the Ontario Nurses Association on a Board of Health agenda as a presentation and waive the board's procedural bylaw to enable this. All those in favor? And that's carried. And finally, from Evelyn Ishbaum, Manager, Citizen and Legislative Services Clerk from Haldeman County regarding the Board of Health Governance. And I guess we'll come back to that after item 8, Charlie, on the agenda. And with that, Ms. McKenna, I think we can begin with yourself and your presentation. And again, thanks very much for taking the time and coming to join us today. It's we've only been together as both councils on a couple of occasions, so we appreciate you taking the time.
Well, thank you very much. And for those that don't know me or anything about me, I'm the president of the Ontario Nurses Association. I'm a registered nurse. I actually live just outside. I live in Central Elgin is where my home is, and work as a nurse in London hospitals. And I've been in this position. This is the beginning of my 4th year as president, and prior to that, have been involved as an owner representative for quite a long time. But I am happy to be able to be here to have a chance to talk to you about some of the concerns that the nurses, the public health nurses, our members have in regard to some issues that have been negatively impacting them and they believe the residents of Halden and Norfolk as well. I want to thank County Clerk Kevin Kleinenberg and the Board of Health for allowing me to make this brief presentation to you this afternoon. Also thanking Board Chair Crystal Chop for extending the original invitation to me via the Hamilton Spectator. I actually got a call asking me when I was presenting. I hadn't actually seen the media clip on that. So at any rate, a little unconventional, but that's okay. Still managed to get it together. So I want to start off by saying that it's really unfortunate, I think, that we're at this point for the community and our members in the health unit. It's divisive. Some of the issues that have been occurring over the last number of months are really difficult. And the divisiveness, as you maybe all know or maybe don't know, between our dedicated public health nurses has been ongoing for months now, and the management at the health unit, along with some of the comments that have been made in the press. But having said all of that, I'm hoping that after today and going forward that there can be a more positive relationship developed and settle some of these issues that are outstanding. And there's really three issues that I want to bring to light this afternoon. One is for you to know that ONA's made many approaches to this employer, particularly after the province emergency orders were enacted in March of 2020. Secondly, the government's additional funding to the health unit and some of the employer's decisions that have caused undue strife and anxiety, and also the issue of ONA being reluctantly forced to file hundreds of grievances now related to a host of issues that are, they believe, outstanding in the health unit. So in regard to the emergency orders, the COVID-19 pandemic that we are all engulfed in and been really so much a part of all of our lives for over a year now, hit Ontario particularly hard through 2020 and continues today. And it covers all facets of the healthcare system in Ontario. We represent over almost 70,000 nurses and healthcare professionals across this province and in public health units across this province as well. And Ontario's public health units are the cornerstone of health in our communities, and they have the valuable expertise around infectious disease prevention, control, preparedness, contact tracing, all the things that have certainly involved the work of public health units in regard to the pandemic. And Halden and Norfolk's public health unit, the registered nurses, professionals there, they're skilled, they're educated, and of course their focus is to protect their community. So when the province's emergency orders were enacted in March, ONA representatives approached the employer at the public health unit to develop letters of understanding to address several issues that were coming up. And these issues included problems with what we believe are violations of our collective agreement. And the collective agreement, the contract, is between parties, and it's between the Ontario Nurses Association, the members, and the employer. But these issues include scheduling, call-in processes, shift distribution, and many other issues. And it's vital, I believe, for all involved to have issues resolved quickly so that the tremendous amount of work that needs to get done during the pandemic and has been being done in very difficult circumstances could move forward. So, but unfortunately, that didn't happen. The employer did not engage ONA. There was no discussion, no collaboration, or even back and forth or options to consider. What there was is an unwavering stand on the employer's interpretation of the emergency orders from their perspective. And they believe, I understand from what I've been told, that they have no obligation to adhere to the collective agreement, despite being provided arbitrated case law to the contrary. And let me be really honest with you. We have a number, I can't even count the number of cases that we have been arbitrated now through the pandemic that very clearly demonstrate what the emergency orders do allow for and what they do not allow for. But ONA, the public health unit here, have been told to accept the employer's way of handling the health human resource issues without consultation. And I'll be honest with you, that's really surprising to me. We have many bargaining units across this province. We represent in 32 of the 34 public health units in this province. And what we're finding and what has taken place in most all of them, with the exception of here and a couple of others that are right now, is that working together to avoid the unnecessary issues should have been and could certainly be the focus rather than the divisive situation that now exists there. It's the most effective way, at least in my experience in many years at this work, to develop the relationship and work through the issues. But regardless of all of that, dedicated public health nurses have continued to work tirelessly and short-staffed to help to keep Ontarians safe. And I don't know if maybe you get, I'm not sure what kind of buildups you have, but right now I know that you have you have vacancies right now for 5 public health nurses. One of your public health nurses resigned yesterday after only 22 days on the job. So now you have 6. Plus, I think you have an RPN vacancy as well. And there are probably other positions in the health unit that I'm not aware of because we don't represent them. But I can tell you that the ONA members at your health unit have worked tirelessly long hours throughout spring, summer, throughout this entire year. And they were really positive. There was something that came to them in October. And we were really heartened when the employer did reach out and say they wanted to discuss the issues that were plaguing the health unit. And so that was quite a movement. And that was really good news. They were hopeful. They thought that the health unit was ready to collaborate and work with them. The employer sent proposals to them to consider. And these were things around the scheduling, the overtime, redeployments, all those sorts of things that were coming up in the health unit and causing some discomfort and inability, actually, in some cases, to get their work done. So I can tell you that ONA took that back and spent time, asked some questions, got some clarity done around the proposal and provided feedback. And that was October of 20. It's February 21. They never heard from the employer. Again, no dialogue, no collaboration, no discussion to help resolve the issues. And the employer continued to rely on their own interpretation of the emergency orders. And this is really, well, disappointing, to put it mildly, but really upsetting for the nurses that work in your health unit. Now I just want to touch on a piece around additional funding that the health unit received from the government to help the community with COVID-19 relief. And so I think everyone in the province, I can tell you, was thrilled when the provincial government announced the additional funding intended to hire additional registered nurses to the health unit. And that was back in 2020. And funding for the additional 5 public health nurses was welcome news for our members, as it would help ease the overwhelming workloads and directly related to managing the pandemic. I was at a meeting with the Chief Medical Officer of Health when he began discussing this, and he was about the need for public health nurses, nurses who were trained and capable of delivering the services in public health units and deemed to be public health unit nurses. That he knew the vacancies existed out there, but he also knew there needed to be more public health nurses hired during the pandemic. So the employer did notify ONA representatives that there was some kind of a funding deficiency. It was unclear about what that really was, and that they would hire 2 registered nurses and 3 registered practical nurses. I can tell you across the province, most all of the public health units who have received additional funding have hired public health nurses, registered nurses. In some cases, they have hired some registered practical nurses as per their collective agreement. But this employer, in this case, your public health unit, decision was contrary to the collective agreement and the discussions that went on in every other public health unit in the province. So the employer requested that ONA amend portions of their collective agreement, but still refused to address the many ongoing violations of the agreement due to the interpretation of that emergency order. So they came to ONA about the situation, but what they wanted to do was amend the collective agreement and change a collective agreement that was already in force rather than working through the issues as the other public health units had already done. So the employer chose to hire registered practical nurses, and just so you know, we have no issue with registered practical nurses. We represent hundreds of registered practical nurses in Ontario. This isn't the issue. It's around the limited scope of practice that in regard to public health work, and it also conflicts with their collective agreement. So the only representatives would have been happy to discuss the issue and to come to the resolution, as I said, and most all public health units in the province did, but that was rejected. So we understood that, or had heard that additional funds from council were used again to circumvent our collective agreement rather than to support the government's initiative for the 5 public health nurses. Yet, this is just an example of the employer pushing through changes without consultation and discussion and collaboration. And I can tell you that what is left is a really sour taste, to put it mildly, but you've got workers, public health nurses, they're hurt, they're angry, and they feel disrespected for the skilled work that they do. So as I mentioned earlier, we've had to file hundreds of grievances in your public health unit. Last April, the employer changed the hours of work from 7 hours a day to 10 hours a day for our members unilaterally and without consultation. In addition, weekend work was also put in place. And I can tell you the public health nurses expected there to be extended hours possibly, or weekend work. But the collective agreement provides daily overtime on more than when they work beyond 7 hours a day, and weekly overtime over 3. And other public health units have the same language, and they were able to discuss, collaborate, and work through this to avoid unnecessary and extenuating circumstances that now exist in your public health unit. The employer refused to honor the collective agreement, to pay overtime or premiums, and provide appropriate notice of schedule changes. The emergency orders do not exempt overtime and premium payments. The emergency orders do not do that. And as I said, there's arbitrated award after award after award that detail that have been shared with your management at the public health unit. We were advised then that the employer that said that overtime would only be paid after 10 hours of daily work and after 8 hours of work biweekly. And so given the many changes in schedules, and this is another really difficult point, is that the constant schedule changes have a huge impact on those nurses. Their ability to secure appropriate childcare, for instance, elder care, compassionate care. The schedules were frequently changed and are frequently changed with less than 24-hour notice, and often members would not even be aware or notified of the change, and they'd miss a shift entirely. And the approach to scheduling can be described at best, I think, as chaotic. I understand that right now there's more than 600 grievances that have been filed, many of which have gone now to arbitration, been referred, and many others still require some grievance meetings. But what's really disappointing, and that most of these issues could have been avoided, I believe, and have been avoided in most all public health units in the province, or resolved very quickly if there had been discussions, collaboration between the employer and ONA representatives right from the beginning, but throughout the pandemic. I find it really difficult, and quite frankly, I'm being honest with you, unacceptable that during a pandemic, to launch a top-down decision without listening to frontline workers and their representatives is just unworkable. And I think that's the situation that we're in now. I'm really hopeful, though. I believe there's always hope, the glass half full situation, that there can be a renewed, refreshing approach to this. And there is ability to repair the relationship between the employer and the nurses there. And I believe it's possible, but I think that there might need to be some encouragement from this board, from the council, in order for that to happen. So I won't take any more of your time, but I'm happy to answer any questions if you have any.
Thanks very much, Vicki. I have a handful of questions and comments to make. Okay. But first I'm going to go to some of the other members, but I want to just reach out to staff first if they wanted to, and if Mr. Burgess or Ms. Miranda, if you're on the call. I can't see your hand, unfortunately.
We can take, Chair Chop, we can take direct questions from the members too, if you wish. It's up to you. Ms. Miranda is on the call, and so is Ms. Anderson from our HR department.
Did anybody from staff wish to make a comment? Any comments before I move on to the board members and Haldeman?
Thank you, Madam Chair. Sorry, go ahead, Jason.
I was just going to say I defer to Ms. Miranda.
Thank you, Mr. Burgess. Through you, Madam Chair, I'll just make a few comments, and then if Erin Anderson wishes to make some comments, I'll leave the engagement with ONA with Erin. I know that with the directors of public health and with both Ms. Anderson and Morgan, there has been a significant amount of dialogue with ONA, but I'll defer to them for those specifics. I can speak specifically to the nursing funding that has been spoken to. As this board is aware, there was funding for 5 FTEs or nursing positions. The funding that was allocated, which we have shared extensively with ONA starting back in the summer when we apprised of the funding allocation, which we too were thrilled to have 5 additional positions to be funded by the province. But unfortunately, the funding was for $500,000, and with our current agreements within the collective agreement, there would be a shortfall of $76,105 on the levy for 2020. With that, and that was for salaries alone, there were no operating costs associated with that funding. So with that, we did reach out to ONA at that particular time and started the dialogue of recruiting RPNs. With the funding envelope that we did receive and the guidance from the province, although it did specify that recruitment of registered nurses was to proceed to the extent possible, within those same guidelines, the qualifications required for these positions are articulated as current registration with the College of Nurses of Ontario, including registered nurses, registered practical nurses, or registered nursing in the extended class. Given that, we did discuss our desire to stay within the funding envelope and to proceed with a combination of RNs and RPNs to complement our nursing program in the schools, which already has a complement of 5 public health nurses. So we continued with that dialogue, I believe, until mid-fall, at which point I think we graciously agreed to disagree, sought a legal opinion, and have since proceeded with the recruitment of RPNs and have since been successful in doing so. So I'll leave that, and I'll have to answer any additional questions on that. And related to the schedule, again, I'll open it up to questions or comments from Ms. Anderson. A lot of dialogue, a lot of effort, both from the nurses, the leadership team, and ONA. Schedules have changed as operational needs have changed significantly over the last 11 months. We recognize that this has been challenging for staff, for nurses, for QP members, but also for the leaders that are involved with the scheduling. We have currently set a schedule on a 7-day schedule, and I think the last time we changed it was in December, and we're hopeful that we'll be able to continue with that schedule moving forward until such a time where we can revert back to our 5-day-a-week, and we're hopeful that that will be sooner than later. And with that, I'll open it up to questions. Thank you for the opportunity.
Okay, thanks, Marlene. We'll likely come back to you in a bit. Erin, Ms. Anderson, did you have anything else you wanted to add?
Thank you, Mayor Chop. Yeah,
there's been quite a bit of dialogue between us, the HR department, management, and ONA, and we hear what the concerns are from both parties, and we're working together to try to work through some of the issues. We have set up bi-weekly meetings with our ONA president and our employee and labor relations specialists, so that there's dedicated time to discuss, what are some of the issues that and how we can work through them. We've discussed with our friends at ONA the call-in process and how we can resolve that issue by, creating a call-in list with people who want to opt out and that sort of thing. We've developed a work from home team where ONA members are part of that, so that they have say in how some of those processes are developed. We've worked with ONA to appoint someone from the bargaining unit to work on scheduling with our non-union schedulers, so that we can avoid some of the short-term turnarounds or some of the issues that have been brought forward by the nurses. We looked at other things that were issues over the time frame of increasing hours, allowing flex time, that sort of thing. So I definitely hear the concerns of our friends at ONA, and I also hear the concerns of management, and I assure you that we're trying our best to work with both parties to help resolve some of these issues. Okay, thanks, Ms. Anderson. And Jason, I saw your hand is up. Did you have more to add now, or?
Sure. I'd like to just say that, we are in unprecedented, and we're in unprecedented times with something that no one really had faced, and no one was given any notice for. And, I used to have a mentor that said that if you start pointing fingers, no one will have any fingers left by the end of the argument. And I think there's issues and challenges on both sides. What I will say is we are, we've always taken the approach, and I think we have a good track record here of trying to balance, all the key stakeholders, be fair to the employee, be fair to management, and be fair to the taxpayers. And, we've made decisions based upon that. And yes, there are legal contract requirements and we've chosen to allow some arbitration to go forward on that front. But we, when we're faced with an emergency situation, we try to take stances that were appropriate on the overtime issue. Ms. McKenna had noted that we were only paying overtime for over 40 hours. That's not correct. We were paying overtime as per the contract for anything over 70 hours, which is 5 hours per week. And the nature of the grievance relates to whether when we switch to a 4-day schedule from a 5-day schedule, whether that provision prevailed or the provision of the 7 hours per day. But we did that with the best intent, frankly, to also give our ONA members an extra day off to deal with the additional demands that were there. So this was not done, with malice. There was thought put into it, and we did try to balance taxpayers' viewpoint, because someone has to pay for these costs. We wanted to balance, our ONA members and their work schedules. And we needed to address, frankly, a crisis situation that required, a lot of extra effort. So, I do look forward to working together. I agree with Ms. McKenna. We cannot continue down this path, and we need to find some resolutions. And but I don't want the perception out there that we did things without thinking, without foresight. This county was one of the few counties, if not the only county, when the COVID first hit, we gave all non-necessary personnel 2 weeks off paid before we tried to lay them off. So our track record with working with labor, I think, is good. We do clearly need some improvements on this relationship, and we are dedicated to do that. But I don't want either councils thinking that there's some malice between between management and ONA. We are trying to work together. And like I said, staff is here to answer any further questions.
Thank you, Mr. Burgess. Councillor Corbett, I saw your hand went up right away there a little while ago.
Thank you, Mayor Chop. With regard to the contractual issues you have, I know there is a dispute resolution for that you said has been to arbitration and other things. Me as a councillor would expect that we have the policies in effect, which is the contract, that I would expect our people to follow and go through. If not, you have some resolution to deal with it. My question to you and owner on something that's been going on for some time that you're quite aware of, and we probably received 1,000 notes from your members too, is the funding that we get from the provincial government for mandated programs, and we're unfunded for those programs. What do you expect to I must say that I had senior citizens call me up who can't afford to pay their taxes. What are they supposed to do? This is something we have to take a look at and resolve within the context of what you're saying. And I must say, I very much appreciate all the efforts of your group, especially these times of days. But there's that out there that we have to take a look at those people who we serve and who come. I'm sure you've had people call you up and tell you, I can't afford to pay my taxes. What are you going to do? I say, I can't do much. It's according to inflation, etc. Oh, I guess you didn't help me at all. So this is what we're dealing with. So we have to balance what we're doing. So it's no strike against your unit. It's just that we have to make decisions that are in the best interest of our community. And thank you for the presentation.
Oh, yeah, and I'd like to just respond a bit if I can, but I'm not sure just how your process works.
No, certainly, Ms. McKenna. Please go ahead.
Okay. Yeah, no, I understand exactly what you're talking about. And as I said, we represent in 32 of the 34 public health units in the province. And I'll just be honest, in the mandated programs, I hear you. And I believe that those mandated programs the government has not done and not only maintained funding, but increased funding based even on inflationary rates. And I think about a number of the mandated programs that have not been touched by government funding increases for years. And that is not just with this government, but with previous governments, particularly Healthy Babies, Healthy Children is the one that stands out for me. That has been one that's been most impacted. But in the other public health units, and I don't know if there's liaison or if you discuss amongst other health units some of the strategies that they have employed in order, they have actually proceeded with in order to offset some of the very issue that you're talking about, and what they have done in order to ensure they can maintain mandatory programs as well as not see big increases in their municipal tax base as a result of a need to bulk up. I can't begin to describe all the strategies in 32 health units, but I hear you, and I know that that is very much a problem, and taxpayers, I get it. They're very concerned about what's ahead and what's happening out there. But I believe that there's a way through it, and there's a way, to a win on both sides of it. But it is time and effort, absolutely.
Next question from the board and Haldeman. If I can't see your hand, Mayor Hewitt, please go ahead.
Can you hear me? Because I'm not sure if you can.
I can hear you
okay.
and see you.
See, we're in Haldeman, we're in the archaic section where our system's a little different. I actually have to physically unmute myself, but somebody's doing that for me, I guess, behind the scenes. But I just, if I can, I'm going to ask a couple of questions, I guess, respectively from our perspective, that Haldeman's not involved near as much as Norfolk and their staff with the process, obviously, as the Board of Health. So Vic, please bear with me, but you know, just kind of expanding on Councillor Corbett's comments and you know, knowing that indirectly as council, we put pressure on Norfolk Council to make sure they're looking at the taxes and making sure that they're sensitive to the budgets and providing the services that are mandated and that are expected, but that they're also reporting back to the public and being able to say that you know, that we're keeping everybody fair and honest in this process. And when you're throwing a pandemic, as you alluded to earlier, it does throw everything upside down. And we've all had to take a step back and regroup and look at ways to do things differently than what we've done in the past. And so, you know, I can't speak to how here because I wasn't part of that process, but as an observation, I can make a couple of comments. And I'm wondering, how do we as this public servants representing the public, how do we respond to those saying that, you know, your union is asking for paid hours, you know, where for hours that aren't worked? I mean, I would respect that in any other circumstance other than the middle of a pandemic. But, you know, I know that talking to the mayor of Norfolk and members of her staff, that they were forced to have to look at revisiting how they were doing business and having to change the structure and some of the hours and going from a 7-hour day to a 10-hour day and weekend work. And I understand, and I know that through our union contracts, that's just not something that normally would happen overnight. It requires consultation and work, but we have to be, in this pandemic, we have to be a bit more nimble and a bit more flexible. And so how can you rationalize 3 hours a day of unworked hours being paid overtime? How do we respond to the public who's going to ask that question?
You know,
so that's one.
Yeah, and I can answer, well, what I understand, because the nurses said to me, you're going to hear someone say to you that nurses are being, you know, they're asking to be compensated for hours that they've not worked. And they're saying to me, that's not true, that the nurses are paid for the hours that they work. The issue is that the employers initiated schedules and changes the overtime payment items in their collective agreement. They're paid for the hours that they work. It's not that they're not working those hours. You know, they said to me that they have heard that through, I don't know what, the press, or I'm not sure what all has gone on in the press, but they said to me that this is false, is that they are paid for the hours they're worked. The issue is that the employer initiated a schedule that changed the overtime payments in regard to the collective agreement as it is. And,
okay, so I'll let those that have that ability or experience to respond to that.
Yeah.
But that was certainly an observation of mine. The other thing is we want to take the best step forward, and I didn't look at all 100 grievances that you have, but I did view a few. And if I take a look at, and if I was to pull some of those grievances out, it would appear to me that those wouldn't be representative of a group that wants to take best foot steps forward. I mean, to the extent that, you know, a grievance such as how to, you know, nurses being trained on how to put a mask on, you know, I almost find that condescending from the perspective that, you know, if the nurses don't have the ability within themselves to become a certified nurse, but require the staff to provide training on how to wear a mask, and that's a grievance. And you know, again, I'm on the outside looking in, and I please take this with amounts of respect. But when I look at that, that doesn't look to me as a group that is, willing or wanting to take a best step forward, because we're asking the public to put masks on, and I don't believe for an instant that we're providing training to the business owners and many of the people who have to adhere to these masks.
Yeah, I don't know the details of that particular grievance, and that's kind of news to me. But what I'd say is that we have we have over 600 work sites in the province, and some grievances on PPE and appropriate training for the donning and doffing of PPE. And it's about the fit testing in particular. And that's really probably the base of it. It's around fit testing. It's not about how to take on and off a mask. It's probably around fit testing, which is required in order to appropriately use particularly the higher level of respirator, which I think have been particularly working in some of the farm situations and with some of the migrant worker situations where they're at risk. And N95 masks are a particular mask, but there is always training that has to be done and fit testing on an annual basis. But I don't know this grievance. Like I honestly, all I know is the numbers of grievances. But
okay, yeah. that's fair. As I say, I'm just looking at it on the outside. Just lastly, and I'll let the rest of the council. How do we respond to the public again in a pandemic when we're faced to do things that we've never been faced to do? And I know Norfolk specifically having to do the inspections and the work with migrant farmers, workers in the house conditions or bunkhouse conditions.
Yeah.
The idea of having to be forced to bring in union representative or nursing representatives in situations where we could be doing some of that workload with admin staff or other staff that would be much more affordable and cost effective and more efficient for us, as well as able or easier for the management and Jason's team to be able to hire different people to fit those positions versus having to schedule nurses in to do that work. It seems like there's just no flexibility from your union's perspective in terms of trying to manage a situation that's much more nimble and flexible. And I think that's, if I can say on the outside looking in, that would appear to be what I see, is that there just doesn't seem to be a lot of flexibility on your part. So, again, it's an observation. Please don't take it.
No. Yeah, I'm not taking it personally by any means. And what I have learned from the other public health units that are in the same situations as you, and similar situations in regard to down Erie St. Clair Way, Leamington Way in particular, with a large proponent of migrant worker, like as you just described, is what they've done is they've sat down to figure this through and to sort out what they can do and who can do it and get it done because of the need in the public. And that's the core of it. What I'm most worried about is that there's such a difficult, divisive relationship now that has been built up even prior to COVID, that's caused, and there's been no open dialogue is what they tell me. I'm not there, and I'm not like you. I'm from the outside looking in, but this is the information that they have, and as I said, in talking to other public health unit leaders and administration around this province, we're not having these kinds of issues. So I do believe it's a relationship problem. I really believe that's true. I think there's a way through it. There's been no playbook for pandemic. I mean, it's been 100 years since we've had a true pandemic. And I think that, there's lots of lessons learned about all of that and what we do going forward. But I think there's a way through this. But I'm worried that because of the relationship as it is, and that it's, both sides are dug in a bit here. And I think that there are solutions to this problem. It's 600 grievances. I mean, many of them are probably similar issues over and over and over again. I haven't even looked at your grievances. All I know is the number. And it's not just 100. It's a lot more than that. And there's a way to deal with those. But there is case law out there. I mean, there's arbitrated labor law out there now on some of the situations that our grievances are filed here that, I'll be honest with you, are going to cost you to get these things resolved. And I hear your concerns about, the cost, but there will, in my belief, you're going to have additional costs that may have been able to have been avoided.
Mr. Burgess, I saw your hand was up.
Yeah, I just wanted to provide clarity with regards to the overtime grievance, and I'll start, and either Ms. Anderson or Ms. Miranda can jump in. The nature of the grievance on the overtime is the workday is defined in the agreement to be 5 days a week, 7 hours a day, which is 35 hours a week. To deal with the pandemic, we switched to 4 10-hour shifts, 40 hours per week. We paid overtime, 5 hours of overtime. But how the collective agreement works, or the position that ONA is taking, is because you moved from 7 hours to 10 hours, they were requiring 3 hours of overtime per day, or 12 hours per week, which meant that, so where the concept of being paid for hours not worked is, even though they were only working 40 hours, they were actually asking for 12 hours of overtime, even though they were only working 5 hours of overtime, which they were getting paid for. There is another grievance out there that is before an arbitration panel on a similar matter, and we are going to wait for that. Management made that decision knowing that there was a risk on that. But we want full public disclosure on the fact that we took the reasonable position that if you're working 40 hours a week, you'd be paid for the 5 hours of overtime, not 12 hours of overtime, because we thought that was a reasonable position to take, since there was an additional day off given to the employee each week. And I'm doing it on a weekly basis just to make it easier, but technically under the collective agreement, it's under a 2-week basis. So it's 70 hours for the 2-week period, and so they would get 2 days, but just to make it simple for everyone. So that was the nature of that grievance. And we will live by the arbitration, how that's there. We just thought, again, from management's point of view, we would pay people for 40 hours of work if we are scheduling them, and we did not think it was a significant inconvenience to move them to 4 days a week to respond to the pandemic, give them the extra day off, and avoid the daily premium. You have to remember that at this point in time, when this happened, the province had also provided suspension of agreements, and that was something that was arbitrated and litigated, subsequent to that date. Ms. McKenna, and just for clarity, I don't want to get into the specific grievance, but it was a stage 2 grievance. I had to hear it. It was related to donning and doffing, and I won't get into it, but there were multiple PPE grievances, and the use of a federally regulated or federally approved N95 cleaning machine. There was a number of those grievances that we will deal with. And Ms. McKenna is also correct. In many cases, there's individual grievances filed plus a policy grievance, so the numbers get up there significantly.
Quickly.
It's not a practice that our other unions undertake. They will just file the policy versus individual grievances plus a policy grievance. So the numbers look a little, that's why we provided in camera for staff on the other one. But I just wanted to be clear with everyone, the nature of the financial grievance, and that is going to arbitration. It relates to whether we should be looking at an overtime provision for 7 hours per day, or whether we should be looking at an overtime provision for 35 hours per week. And that is the difference that we have. And management does have a difference of opinion with the union on that one, and that one will be settled. But it should be transparent that, we are paying for every hour of overtime over 35 hours a week. Nurses get paid for that. It's just that we are not paying for the shift premium for each day, and because we are offering a day off instead. That's a difference of opinion between owner and management, and that will be settled there. But we just, from management's viewpoint, I will say that there's a lot of people who are on serve and taking that time off. We thought again, we have to weigh the interest of the taxpayer, public interest, and the union agreement. We thought we took a fair position on that. ONA does not agree with that, and we'll arbitrate that out.
Right. Yeah, and the arbitration, it'll be what it'll be, as you just described, and like I understand that, and I think I just think there's another way to deal with that as the other health units have, because they're in very similar situations. But I'm not, we're not here to sort out every grievance. In regard to the PPE and the donning and doffing, I will say I heard you mention the federally approved N95 cleaning machines or whatever that were on the market and maybe still are on the market. And I'll just say that at the provincial tables where I sit, those reusing, I know there was a huge concern around supply of PPE. In this province, there is no issue with supply of PPE. There is provincial stores available to anyone, to any organization, healthcare organization. And just, I think, Jason, you probably know this, but I'm just saying that those machines in Ontario, it was never accepted to use or reuse. It was, that was never anything that Dr. Williams agreed to, or it was not, I'm just saying it was never, it was out there, they were being tested, but they were never used or approved for reuse of PPE on those masks. It was at a time when it was worried, there was a great worry, including keeping a lot of people up at night, that there wouldn't be enough PPE and that we'd have to reuse PPE. But that is not the case in Ontario. So
yeah, it's not the case now, but at the time you were unable to source N95s. We were unable to source surgical masks.
Yep.
And it was management's position, and frankly, management wrote a big check to get one of those machines in, because for management's position, we thought it was better to use that machine than to go with the homemade mask. So we, again, though it was not, welcomed by the union, it was management's position that was the best foot we could put forward to provide safety for our employees, and we provided that. We did not use it heavily. We were able to get supplies. But again, it comes back to it as we were trying to provide as many flexible options as possible and give, because if it was a choice between a reused and sanitized N95 mask or a cloth homemade mask, management's viewpoint was we'd give them the sanitized mask.
No, I understand that. I'm just, there's some things that I'm just suggesting that might be able to be resolved sooner than later on this kind of stuff, so they're not sitting out there for you to deal with. But that's something you'll have to work through. But that would have been the PPE thing, I'm sure that would have been the crux of that grievance.
Councillor Martin, go ahead.
Thank you, Mayor Chop. I guess there's a lot of specific discussion about specific grievances going on, and council is privy to some of it and not all of it. So I might be jumping around here a little bit, but through you, Mayor Chop, to Ms. McKenna, was there something in particular that happened in October? You mentioned that it was heartening for ONA. Was there something in particular that was appealing, or just the discussion in general?
Well, what I understand, from what I have been told, what I understand is on October, so leading through March and through the 2020 year, a lot of situations and disputes were arising. There was high anxiety, all of those things happening during the pandemic. And in October, management approached ONA with some proposals, I think, or resolutions to some of the issues that were outstanding. And that is when the leaders said to me, and the nurses were telling me, is that they felt really hopeful. Okay, we can sit down and sort some of this so that, we can all come to, a meeting of the mind, so to speak, and worked on the proposals, asked for some clarification, got some questions answered, sent the proposals back to management. But there has, what I've been told is there's been no response from management on those since October.
So Martin, we've lost you there. Yeah, I think you're back on mute.
Thank you, Ms. McKenna, because then we're hearing from our staff, I don't recall if they said bi-weekly or bi-monthly, but that there's regular dialogue happening now. And so from that perspective, and that's another thing, I don't want to overstep here, but council's not briefed on the discussions and the dates that they occur per se. So I could be without some information here. But the other thing you said was that there was some finances that were helpful that the county used to circumvent some of the situations regarding the 5 RNs. Can you elaborate on what you mean by that?
Well, what I was shared with me is that there was some additional funds provided. So as I think it was Jason was explaining that, or Melanie maybe, I'm not sure, that the amount of money that was received to hire the 5 public health nurses was insufficient. And that I was told that there was some money released in order to augment that. I don't know the amounts, or I have no idea about that, but that in fact, that didn't happen, and public health nurses weren't hired, and there were 2 public health nurses, I think, hired, and 3 RPNs, and I think it was, Jason said they were short around 70,000-ish, I think I heard him say, but I don't know the details of that, just that it was explained to me that there was it seemed to be a bit of a workaround to achieve what was intended, but it didn't happen.
Maybe I could have staff chime in on that. I believe it was Marlene who commented 76,000, but before staff does that, could they also share on the public record the hiring process to get this done? Because logically, if we've hired 3 RPNs and 2 public health nurses, it would make sense to just go and try and hire 4 RNs if we couldn't afford to do all 5, and then reassess with that extra pool of money. It would make sense to try and get as close to the mandate provided with the funding available, but my understanding is our staff had a difficult time with that. So could we just, on the public record, discuss the actual hiring process and what we ended up with?
So through the chair, it's Marlene, if I may. So I'll start and then I'll defer to Ms. Anderson if she wants to add anything from the actual hiring. So the ministry was very specific that we were required to hire 5 nurses. Ideally, as I said earlier, it was where possible to hire 5 public health nurses or 5 registered nurses, if I may. With the funding that was allocated, once again, to our health unit, we received $500,000, which was only for salaries and benefits, was not able to use for any other operational costs, i.e. IT support, training, etc. So given the $500,000, if we were to proceed with 5 registered nurses, there would be a shortfall again of $76,105 within the 2020 budget. So with that, and with the requirement that we had no choice but to hire 5 RNs, with dialogue with ONA, with management and HR, we worked towards hiring within that funding envelope of $500,000 2 public health nurses and 3 RPNs. So we have since then been successful in recruiting the 5 school public health nurses that the $500,000 was dedicated to. As far as the internal process through the collective agreement, the process needs to be exhausted first. So we have to post all postings internally, and with that sometimes comes multiple internal movements. So if nurse A applies for a job, then her position needs to be backfilled, but then another nurse could bump into that position. So there's a bit of a ripple effect in the time lag for that to all occur. Once that's exhausted, then we're able to recruit externally. So because of that, and because of the high demand for the nursing across our province. We have had delays in hiring, but as I said earlier, we have been successful in recruiting the 5 required positions at this point in time. I don't know if Erin wants to add anything else, and if anyone needs any more clarity on that.
If I may, Mayor Chop, I would like to just seek clarity. When you talk about school nurses, what is the actual position of a school nurse?
So the position, according to the new guidelines, was an additional 5 school-focused nursing, which kind of came under that initiative that was going to be 100% funded by the province. So unlike a lot of our other mandated programs, that's now a 70-30 split. This particular initiative was at 100%. So these, if I could read from the guidelines here briefly, these school-focused nursing initiatives was created to support additional nursing FTE capacity in every Board of Health to provide rapid response support to school boards and schools in facilitating public health and preventative measures related to COVID-19 pandemic. And it goes on to give more specifics, and I'm happy to share that with the board, but that does give a high-level overview of those positions. And as I said earlier, we currently already had 5 FTEs in the school system, and this enabled us to have an additional 5. So we currently have a complement of 10 public health nurses supporting our schools through the COVID pandemic.
Sorry, I guess I'm probably not asking my question properly. On that guideline that you're reading, it doesn't say 5 RN or 5 RPN. It says 5 school nurses.
Yeah, so as I stated earlier, it does specify recruitment of registered nurses to the extent possible. But as you continue to read the guidelines, the qualification specifically states that it can be a current registration with the College of Nurses, including registered nurses, registered practical nurses, or registered nurses in the extended class. So any of those nurses could be recruited for these 5 positions, which is the approach that our health unit took to stay in keeping within the funding, and additionally with the understanding that RPNs can fulfill this mandate, and RPNs, it is within their mandate to be able to provide the services that is required with this initiative.
Councillor Martin, if I just could, so Ms. Anderson, maybe you can kind of jump in when you and I had the conversation and just explain a little bit for the Board of Health and Halton County Council. But, you know, some of these explain maybe the delay in hiring process. And this is one of the challenges. You know, we're in a pandemic. We have to move quickly. We've needed people, and where, you know, as a result of the rules within the collective agreement, which normally would not be a problem under general circumstances, but during a pandemic, it's creating a backlog here where sometimes we're having to, you know, go through multiple rounds to be able to hire for a single position as a result of having to post internally and so on and so forth.
Thanks, Mayor Chop. I'm happy to explain, and Ms. Miranda had alluded to it in her response, but absolutely. So, you know, when we post a position, we post them internally first, and what that means is anybody within the ONA bargaining unit has the ability to apply to that position. And that it's awarded based on seniority. And so when we posted some of these new COVID positions, even though they're temporary, we had some movement from our internal nurses who wanted to, you know, take on a different role within the bargaining unit, try something new, expand their skills, that sort of thing. But what that does is it actually creates a different vacancy in their other position, and so we have to post that. So going through all this posting process and with internal movement, sometimes to actually fill a vacancy with an external person, you know, can take anywhere from weeks to months to do that. And with these school health nurses, you know, we did reach out to ONA proposing a letter of understanding to hire the RPNs. You know, essentially, we didn't get anywhere with that. And so it took us a little bit longer, where we could have potentially had people in those jobs sooner, as we tried to work through some of the dialogue with ONA.
Thanks, Ms. Anderson. Further questions, Councillor Martin?
Well, that's okay for now. Thank you, Mayor Chop.
Anyone else? All right, so I have a few. I guess I know, I'm sure, Ms. McKenna, you read it in the article in the paper. I need to know, I mean, from my perspective, I have long been almost even criticized, so a union supporter. I grew up in a family where my dad was a negotiator for OSSTF while his brother sat on the management side. One was a superintendent and one was a principal. So you can imagine what our family dinners were like from the time that I was a kid. However, you know, and I think it was, you know, Mayor Hewitt that stated I respect a collective agreement, and during ordinary times, as in the example of the overtime payment that we're talking about, I would absolutely agree with you. If that wasn't within an LOU to have that scheduling changed and between 7 and 10 hours a day, they wanted to work more than the 7 hours a day, absolutely, you know, that 3 hours would apply. But the province in the midst, here we are in a global pandemic, and, you know, expediency was a must in order to be able to adequately address this situation. And I'm sure you'll agree. I mean, the step that the province took to suspend collective agreements under the Emergency Act, I mean, that is unprecedented. I couldn't even believe it when it had happened myself. But it was because, you know, we needed flexibility to be able to address these situations. And so, you know, like Councillor Corbett stated, it's, you know, we have other considerations here. It's also about we're balancing people that are losing their jobs and losing their businesses. And, you know, we, as our public health unit, you know, they ultimately got an extra 2 days off over that 2-week period. They got 10 hours of additional overtime pay. And I think that was a pretty fair approach by staff. You know, again, I've read the arbitration decision that you've spoken about. I even had my dad there from OSSTF. I had him read it as well and give me his opinion. And you know, we'll see. We'll see where the chips fall with that one. But I agree. You know, we need to learn to work together moving forward. And I think that, you know, a lot of this has kind of come down to, well, you know, they said to me, or this is news to me, or, you know, I've heard you make some comments to that end. And, you know, I think what would be really helpful is if maybe we could educate you a little bit more, or our staff could, you know, on some of the challenges that we are facing. Because I don't think, and even HR, Ms. Anderson, you heard her say, it's not all the union, you know, and there are challenges on the management side. But maybe it's time that we need, you know, from your level within ONA to come down and sit down with our CAO, and given the number of grievances and work, you know, work towards a solution on some of these matters. So is that something that that you would be amenable to? Because I think in some of these instances, you're not necessarily getting, you know, the full story.
Well, that could be, and I would say vice versa. I'm sure it's a bit of both on both sides of it. I just, one of the statements you made is when the emergency order suspended the collective agreement. The collective agreements are not suspended. There's only a few provisions that are under the emergency order. So just to be clear about that, but we could, you know, go back and forth on interpretation of this and that. But I do agree, there has to be a way through this, and it will only become by developing the relationship and having discussion and the people, the decision makers at the table, in order to make that happen.
So which provisions were suspended? Well,
as I mentioned earlier, overtime and premiums are not suspended under the emergency order.
But I'm asking the question, was scheduling suspended?
There was the ability to change schedules to some degree, yes, but there was provisions about how that would be done. So I don't have the emergency order in front of me, but that's something that you would sit down and go through and ensure that you are complying with the order. And we believe you're not. And there's not just one case, Mayor Chop, on this issue. There are multiple cases now that have been through arbitration, not just ours, but other groups as well, where there's been challenges to the interpretation of the emergency provisions. So But I mean, we can argue about that all you want, but I really not sure that that's helpful. I think if we want the end we need to get to is to have a path forward. And that's about sitting down and sorting some of this stuff out. And
No.
I think that's not going to happen unless we agree that we can do that.
No, I think we need to get to the table and come to an agreement on a number of these issues. And I think that it would be, again, very helpful, you know, if you know, you were able to come down and participate in some of those discussions, and we can both agree on our council and on the union side that, you know, there's parties at fault in both directions, and that we would like to sit down to the table and at the table and negotiate a settlement to all of, you know, these outstanding issues that are there. As we move forward, I think, you know, we have two priorities at the end of the day, and most of your members actually live in our community as well. And, you know, it's beating COVID-19, and now it's dealing with the vaccination rollout. And, you know, is an RPN, as we're planning our vaccination rollout, is an RPN qualified to give a vaccine?
Well, I think that what the most recent, and there's been recent amendments in regard to there being allowances for people to give vaccines who would historically not be. And that's about the delegation of what are deemed to be controlled acts under the regulations that exist. And there's a certain amount of training that is involved because, as you well, all of you well know, they're talking about pharmacies. They're talking about pharmacy technicians, pharmacy interns in a local pharmacy, for instance. There's a multitude. Like, we're going to need boots on the ground to have a mass. We haven't never, our lifetimes, had a mass immunization that is going to need to happen here in order to get people vaccinated. And that's the job. And Dr. Williams has handed that really to the public health units to implement, and how that's going to happen along with other stakeholders and partners. So there is lots of discussion about who and how that needs to happen. There needs to be someone responsible who has the ability to delegate a certain skill or a certain task to an individual.
I just want to read again, because I'm a little bit lost myself there. So, like you just said, this is an undertaking that we have never experienced before, mass vaccination rollout. And we need all the help that we can get. And in many of the jurisdictions that you represent, I remember right when this first hit, our staff was right on it. We created a list of volunteers. All kinds of people had put forward their names. Of course, they were going to be paid volunteer positions. And we've never been able to draw on them or call on them. Yet in many other health districts, they have used volunteers. They have used RPNs for many of the tasks that are actually being grieved, that you believe that are solely an RN task. I understand it comes back to there's different language between the collective agreement in the Haldeman Norfolk Health Unit and the collective agreement in other health units. But my goal and our goal as a community, as a country, is to deal with beating COVID-19 and to effectively roll out the vaccination. So again, we need boots on the ground. So can I get you to say, are RPNs qualified to deliver a vaccination?
What I'll go back to is what I just said to you, is that the regulations under the Public Hospitals Act, under the Regulated Health Professions Act, these are the things that govern who can do what, not just a decision that's made at a local table. So if there's going to be delegation under the Regulated Health Professions Act, for instance, to give vaccine, then there's a process, and that's about training. And it's about an individual who holds the ability to perform that act, to agree to delegate it to someone and be responsible for what they do. That's what the delegation acts talk about. So it is a discussion that needs to happen. It's happening right across the province. As you're right, you've got volunteers. You have retired nurses probably sitting on a list who no longer hold their license in the province of Ontario. And the College of Nurses of Ontario is not granting them a temporary license. What the College of Nurses of Ontario is saying is that these folks can be very helpful in your vaccine clinics. However, you have to do the proper delegation under the Nursing Act in order for that to happen. And so I see Jason sitting there, I'm not sure who else from the management team has probably been thinking about that or discussing that already, and how they're going to action that out and get their sort of, folks, the boots ready to go and set up the clinics that need the way they happen. But no, Mayor Chop, I'm not going to say that X person can do this. There's a process to it happening. And I'm expecting that there will be all kinds of folks who normally wouldn't be giving these kinds of vaccines that may be working in clinics under the Delegation Act. And that's what you need to be looking at.
Okay, so hopefully when that does come, see then if under the Delegation Act that we are able to use some of these additional people to roll out the vaccination program. At the end of the day, though,
you go through the process, right? It's a process thing, and it can happen very quickly, but you have to take those steps in order for that to happen. And I'm sure Public Health Ontario has some criteria to help health units work through this and get their people together and trained, ready to go.
I understand, but I also can see, again, I get that it comes back to the different collective agreements between the different health units, but there is also, there has to be an appreciation that we're in a pandemic, that we are a community, that we are battling this together, and that, we need to make some decisions quickly, and we need the union to be flexible on some of these matters, coming back to Councillor Martin's questions about the 5 RNs and a mixture of RPNs and RNs. At the end of the day, for the work that was being asked of them, while it may have been, I'm not going to argue on the language of the collective agreement, but they were qualified, the RPNs were qualified to do that work. So I guess, without getting into, I don't think there's much point in getting into details and so on. But again, I wrote down another, it's clear there is a divisive relationship that's going on. I think that we need I think that it would be important to have you better understand some of the details of these grievances. I think it would be beneficial to have you and our CAO sit down at the table to go over some of these matters, because we are in a pandemic, and we need to come to an agreement as quickly as possible so that we can move forward.
I agree that there's a way forward, and I think that there's got to be some mutual fact understanding that maybe isn't there. For sure. And the list of 600 grievances, I'll be honest with you, is that I don't work in a servicing role. I'm happy to help and support, but it would be my legal staff that would be doing this with your management staff as well. And, we'll work through it, and we'll get the right people to the table to make that happen. It's probably not the best for you and I to sit down and try to argue.
I wasn't proposing me. I was proposing our management staff with yourself. But again, I've just written down a number of times that you've come back and you've said, they said to me, it's news to me, what they tell me. Well, that's
because I am briefed, right, on what's happening. As I mentioned earlier, I have over 600 different bargaining units out there, and we have over 300 staff on the ground working with almost 1,400 leaders. So I'm just, I am not familiar with the minute details of absolutely everything, nor would I think anyone expect that. But I was giving you the overview of the information that was shared with me. And, I don't want to get in an argument. And I think that there's, as I said, I just was hoping that there would be the willingness. And I didn't want there to be misunderstandings amongst the council. And because I guess there's been a lot in the press, I haven't been reading it all, but I guess there's been a lot of things back and forward. And I think that that's not helpful for either group. I think we need to move away from public discord as much as we can and get to the crux of the issue. However, if the frustration levels are high on both sides. And so I think that we hopefully can see through the forest here and get something done.
Absolutely. So you're saying then, I'm just curious, Mr. Burgess, who is it from ONA, I think that would be most helpful for you guys to have a conversation with? Because I guess a little bit from my perspective here, you know, one of the comments was not understanding why there's a funding deficiency, and I think that has been well reported. You know, our nurses here in Haldeman and Norfolk are making more than $100,000 apiece. It's very easy to understand why there was a funding deficiency for us to be able to hire strictly 5 RNs. And I want to support, you know, kids that are going to school for an RPN job here when they're qualified to do that same work, especially during a pandemic and when we need their help. So, Mr. Burgess, is there a suggestion?
Yeah, so currently how it's structured is I'm only ever involved once it goes to a stage 2 grievance. So I don't necessarily get involved in each of the grievances. The public health unit, the general manager is the technically CAO of that unit, and then it reports up to me. So I think, I think for this to work effectively and to reset the relationship, I think we would need, my suggestion is, I can certainly insert myself into it, and I think there needs to be not just local representation, but potentially some other, some other support, maybe not Ms. McKenna, but maybe some other support from outside the local union with our management team, with our GM, and maybe just try to do a reset with a few fresh eyeballs around the table to drive to some solutions.
Ms. McKenna, is that amenable to yourself?
Oh, I think that, we should discuss who can be at that table and have the right people there that have the information so that can get on the table and get dealt with. I mean, we'll select our own representatives to be there. But certainly the local parties should be in the discussion so that they're the ones that are going to be left behind when if things are able to get sorted out. So you want to include them, but also you need to have the expertise there that can bring maybe a bit of a different view to it, who aren't so involved in it on a day-to-day basis, right? So I think that would be helpful. And I can certainly talk with our staff and Jason. I don't know who all you would want to have a discussion with, but and how soon they can do that. As you said, we're all in a pandemic, but we've got to deal with this. We can't just let this continue to percolate, I think.
No, I think we definitely need to come to a resolution. I mean, there's a little bit of a contradiction going on right now. I know our public health staff is overworked. It has been a long year for everybody, but then when we're facing challenges with doing hiring and so on, we need to get to a resolution so we can fill up every position that needs to be filled, as you say, and, get moving forward here. So I don't know. I was originally thinking that I would make a motion directing our Jason, do you still think that's necessary, or can I just leave it to you and Ms. McKenna to set up?
Yeah, I'll take it as advisement, and I'll contact both the local union representative with General Manager Heidi and Aaron, and we'd ask for them to bring in additional representatives so that we can expedite the process and go from there.
Yeah, I think that would be really helpful. I appreciate that, Jason, and just so we can get moving. But I have one question. Maybe you can help me with this. So you've got 6 public health nurse vacancies right now, and one RPN position that I hear of. I don't know about other employees. So are those positions, like, the recruitment is a problem and people are anxious? I mean, nurses are in high demand. So are these positions, these 6 positions, posted right now or will be posted soon? Because the nurses currently are trying to pick up the workload of these 6 public health nurses along with their own load, right? So,
Ms. Anderson, there's multiple postings out, both at management. There's significant vacancies in management also, Ms. McKenna, and which compounds the problem. But I'll turn it to Ms. Anderson as far as the number of positions that are posted currently.
Thank you. Yes, all the vacancies that we currently have are posted. Some of them have had to be reposted, having trouble recruiting in some of those areas, and so we're doing either further reach out. If Ona can suggest how we can bring people to the table, please, I'm all ears. But yes, every vacancy that we have in public health is posted. And when we get qualified applicants, we interview and move the process quite quickly. And if they're still posted, it's because we're having trouble recruiting or it's a new vacancy.
Okay, so
I was just gonna, sorry, I was just going to add, Ms. McKenna, that for a number of positions in public health, we've actually streamlined and reduced some of our HR interviewing for some of the administrative positions. We've got people who are retired, and we brought them on more rapidly to again push work off. We've also, just for your information, we've significantly redeployed staff to the health unit to support the health unit. Most of my IT team has been there doing the work from home program. You know, my finance team has extended resources into it, or my aquatics team. So, you know, yes, there are positions open there, and we are, you know, if I could get 6 nurses, that's not a problem. But I just need you to understand that this county has contributed significant, has thrown as many resources as we could to help your members out as much as possible. So, you know, just to be clear, I have, like I said, almost my whole IT team was there doing the work from home program, which was a big concern for your members. And that delayed every other program throughout the county. So it's not just getting the nurses, it's also, we are providing significant support to them in all other manners, just to be clear.
well, that's good to hear, because, you know, well, obviously, and this isn't, you know, hard to understand. If you've got vacancies like this, that work still needs to be done by those left behind, right? So that is part of the workload situation that they were describing to me, which they're worried about. And, you know, trying to maintain is a big focus, like you mentioned as well. So they're on that. And, you know, it's a concern. I mean, I'm just being really honest with you. And there's some of the casual positions are still vacant, or there's 3 COVID casual positions they told me that are vacant, which, you know, is also adding to the burden. But at the end of the day, it's about fighting the pandemic, absolutely. And we need to find our way through to make that happen. So, and with these vacant positions, I don't know how long they've been vacant, but those are salaries that aren't being paid, right? Which just, you know, that when you don't have someone in a position, you're not paying a salary. So there are funds there. And what some of the public health units have done is to hire recruiters. Like, I don't know how you're recruiting. I don't know where you're posting your jobs. I have no idea if you're using Health Force Ontario portal, if you've got your jobs up provincially. I don't know what you're doing. But when you asked what can you know, if we had any suggestions, yeah, I've got some suggestions, but I don't know what you do now. I don't know if they're posted on an internal board, if you're just going up on your own public health website with your jobs. I have no idea, but there are other opportunities because this is an active job market right across the province.
Well, maybe those are some questions we could have you reach out with Mr. Burgess and staff after the fact, and there can be some better dialogue between both sides. Marlene, did you wish to speak? I thought I saw a hand a minute ago.
Yeah. Thank you, Mayor Chop. If I may, as the Chief Nursing Officer, I'd just like to come back to your RPNs are qualified to do vaccination and some of the commentary from Ms. McKenna. So I'm just going to give you, if you'll indulge me, a little bit of an overview of the standards of practice with the College of Nurses and then who is and isn't qualified. So nurses all study from the same body of nursing knowledge with nurse practitioners and RNs and RPNs studying for a longer period of time to achieve a greater breadth and depth of knowledge. But all nurses are accountable. The College of Nurses Ontario and 7 professional practice standards, including accountability, continuing competence, ethics, knowledge application, leadership, and relationships. With a few exceptions of 3 of those standards, there's some enhanced requirements for nurse practitioners and registered nurses, where they are also needed to demonstrate enhanced standards related to research and application, coordination of care in complex clients, and demonstrating leadership when collaborating with care partners. So I just want to state, and just for the record, for clarity, that for an RPN, vaccination is not a delegated act. It is part of their scope of practice, and they are very capable and qualified to perform that duty. Although it's not in keeping currently with our language in our collective agreement, there is absolutely no reason why they couldn't perform that task. So I just wanted to clarify that it is not a delegated task. Thank you.
You are right about that, and I'll just say that there has been varying degrees of training and education in the RPN classification. I think you're probably quite aware of that. And in many cases, not all RPNs will be skilled and knowledge to give vaccine. That's the piece around someone who does have the skill and education can delegate and train someone to do it. So, I mean, there's all kinds of intricacies, and I don't want to get into a contest about it all, but just to say that a classification does not necessarily have the training. They are required to acknowledge their competencies, and they are absolutely responsible. However, I think you will find that many will declare that they don't, and that they will need the training from someone who is skilled, and that therefore the training can happen in the delegation once that individual has demonstrated the skill, then they're off to the races. But there's, as I said, it's a process, and that's the issue, and I think that that's what's important.
Fortunately, we do actually provide the training within the health unit. So hopefully once we get to moving this vaccination rollout to be successful for our 64,000 residents, we'll be able to have some cooperation on that matter from the union, because it's of critical importance that we get this done, and when the vaccines arrive, that we're able to get them distributed to everybody. So I'm just going to move on then. Councillor Corbett, did you have something else?
Yes, I do. I have a very important meeting to attend. It's my 53rd wedding anniversary, and people are awaiting me. Thank you for the interchange.
Thank you, sir. Have a great day. Congratulations. Happy anniversary. Okay, so any further questions from any of the board members or Haldeman? I think then I might just like to codify that in a motion, if it's possible, just that we direct the CAO to meet with ONA representatives outside of the local to get rapid resolutions and report back to the Board of Health. If there was somebody from Norfolk County that was willing to move that. Councillor Huffman, and seconded by Councillor Van Passen. Any further discussion? All those in, Councillor Martin, go ahead.
Sorry, Mayor Chop, slow computer today. Sorry, can you just repeat the last part of that? They are reporting back to council or to Board of Health?
And report back to Board of Health.
Okay, thank you very much.
Okay, all those in favor? And that is carried. Thank you very much, Ms. McKenna, for joining us. Really appreciate your time.
Thank you very much as well, and hopefully be on a better note the next time we meet. Thank you.
Look forward to it. Thank you. Does anyone need a 5-minute break, or do we want to just press on? Okay, in that case, we will press on with the next item on the agenda.
Mayor Chop, should we not receive Ms.
Oh,
McKenna's presentation?
You bet. If I could have a mover and a seconder. Councillor Taylor, seconded by Councillor Huffman. All those in favor? And that's carried. Okay, so next is staff CS 21-10. That's deferred from the February 2nd, 2021 Board of Health meeting regarding the extraordinary cost funding.
Mayor Chop, if I could suggest, the PowerPoint presentation that's in the closed session and the previous report that was deferred from November, they're all combined I'm wondering if it would be more effective to go in close and deal with it at least in order before we come out for the CS 2110, as the decisions made on those previous ones may make CS 2110 have no standing at that point in time.
Okay, so at this point, we'll move into closed session then?
That would be my suggestion. I think it'd be the easiest to deal with it. Then you can come out of closed and with your decision, then deal with CS 2110 if it's still required to be dealt with.
Very good. Kevin, are you able to read the motion and to proceed into closed session for each of those items?
Yeah, absolutely. That the Board of Health convene in closed session at 5:09 p.m. to speak about matters pursuant to the information memo, read Ontario Nurses Association Grievances Summary 2020, information memo, Haldeman Norfolk Health Unit COVID-19 Extraordinary Cost Funding, additional information, and staff report CAO 20-30, read COVID-19 compensation matters, pursuant to Section 239 2B and D of the Municipal Act 2001 as amended, as the subject matter pertains to personal matters about an identifiable individual, including municipal or local board employees and labor relations or employee negotiations.
Thank you. If I could have a mover and a seconder from Norfolk. Councillor Taylor, seconded by Councillor Van Passen. All those in favor? And that's carried. Okay, and do you have a new link for us?
Yeah, I sent it out shortly after the beginning of this meeting.
Okay, perfect.
I do have to run downstairs quickly to get a power cord, but I'll be there shortly.
So Board of Health receives it. I'm not concerned. I think it might be a technical thing that the policy going forward would have to be a Norfolk County policy over health unit staff because there's that division between what the health unit can do and what Board of Health can do.
Everybody.
We are now live.
Okay. Can you hear me?
Okay, we're good. Welcome back, everyone. Just a motion to reconvene in open session. Moved by Councillor Taylor, seconded by Councillor Martin. All those in favor? And that is carried. And Kevin, if you could go ahead, please, and read the motions.
All right, is my audio working? Is my audio?
No, we just heard you now.
So, that the information memo regarding Ontario Nurse Grievance Summary 2020 be received this information.
I think we did. Oh, I see. Councillor Huffman, if I could have a mover. Sorry. Are you willing to move that? Thanks, Councillor Taylor. All those in favor? That's carried.
The information memo regarding Haldeman Norfolk Health Unit COVID-19 extraordinary cost funding additional information.
Councillor Martin's moving that and seconded by Councillor Michelle. All those in favor? That is carried unanimously.
Sorry, I wasn't making it on the live feed apparently. Whereas the provincial government requested the health units track number of hours worked for all public staff, including
Kevin, your mic is just breaking in and out, and maybe if you want to just kind of slow down reading that there for us.
Whereas the provincial Whereas the provincial Conservative government requested all health units track numbers of hours worked for all public health staff, including the medical officer of health. Whereas the medical officer of health submitted approximately 1,060 hours of additional time worked for an additional total compensation of approximately $160,000. Therefore, be it resolved that the board transferred the provincial payment of approximately $160,000 to Dr. Shankar Nisithari, medical officer of health.
Okay, so mover and a seconder. Councillor Michelle, seconded by Councillor Huffman. All those in favor? And that's carried unanimously.
Next motion is whereas the province provided additional funding for COVID-19 pay allowance for eligible non-union public health staff. Therefore, be it resolved that staff be directed to distribute those funds to eligible public health staff, totaling approximately $102,000.
Mover and a seconder. Councillor Taylor, seconded by Councillor Martin. All those in favor? And that's carried unanimously.
Okay, next is the confirming bylaw. That bylaw 2021-06 being a bylaw to confirm the proceedings of the regular Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held on the 24th of February 2021 be approved, signed by the chair and board clerk and affixed with the corporate seal.
Mover and a seconder. Councillor Taylor and seconded by Councillor Huffman. All those in favor? And that's carried. And just before my motion to adjourn here, I just want to take the opportunity to thank all of our, not just our public health staff, but all of our staff that have worked through COVID-19. And certainly, you know, I hope that with the opportunity to speak with Ms. McKenna, today and her joining our meeting. It was a privilege for her to come down, that hopefully with some further dialogue, we can start to get to iron out some of the challenges and divisions that have existed within frontline staff and the grievances that are on the table. So hopefully we can see some resolution to those issues, and certainly we all owe our public health staff and again staff in other departments that have helped manage this pandemic a debt of gratitude. So thank you again. So with that, just a motion to adjourn. Councillor Martin, sorry, and Councillor Michelle. All those in favor? And that's carried. Have a good night to everyone. Thanks, Kevin.
Good night.
Thank you. Have a good night.
Madam Mayor, thank you, everyone. Good night.